So I have already tested my patient's vision acuity on the Snellen chart test. She was able to read all of the letters on the line 20, but was unable to read the letters below that. I've also taken her vital signs. Her temperature was 98.3 degrees Fahrenheit. Her pulse was 80 beats per minute. Her respirations were 17 breaths per minute, and her blood pressure was 120 over 80 millimeters mercury, and it was taken on her right hand, and she was sitting down. Okay, so hello, my name is Jacqueline. I'm going to be doing a head-to-toe assessment on you. Is that okay? So she's giving me consent, yes. Can I have your name? Okay, can you state your date of birth? Are you allergic to any medications? Are you allergic to any food? No, okay. Are you allergic to anything in the environment? No, okay. Where are we? What is the date today? And who is our President of the United States? Okay, good. So, what kind of mood are you in today? Do you usually wake up in a happy mood? Okay. Are you experiencing any pain? No, okay. I'm glad you're not experiencing any pain. Why are you here today? Okay, so I just have a couple of questions about your bowels and your bladder. When was the last time you had a bowel movement? Okay, can you describe the color and consistency of your bowels? How often do you have a bowel movement? How often do you urinate? Could you describe the color and consistency of your urine? Do you have any pain, discomfort, or odor upon urination? No. Okay, good. So now I'm going to go ahead and start my assessment. I'm going to hand sanitize, and I'm going to get my pen light. So with my pen light, I'm going to be checking the patient's ears first. So the external ear has no drainage or swelling. The ear canal is pink with minimal cerumen. So this side as well, the outer ear has no drainage and no swelling, and the ear canal is pink and with minimal cerumen. So now I'm going to move to the mouth. I'm going to instruct the patient to open their mouth. Her mouth is pink. Her oral mucosa is pink and moist. Her teeth is white. I'm going to have her lift her tongue. Her frenulum is midline. I'm going to instruct her to stick out her tongue and say ah. Okay, so I can assess her tonsils. She has grade 1 tonsils. Good. So now since I have the pen light, I'm going to be doing some eye tests. The first test is going to assess her constriction, both direct constriction and consensual. So the first one I'm going to be checking direct constriction, good, consensual. Okay, so again on this side, direct constriction and consensual, good. Okay, so now I'm going to instruct the patient to follow the tip of my finger with her eyes only and not to move her head. My finger is positioned in between the patient's eyes, and I am testing the cardinal fields of gaze, the 6 cardinal fields of gaze. Okay, and then I'm going to see if she accommodates. She accommodates well. Okay, so since I do have the pen light, I'm going to have the patient at a 45-degree angle to check the jugular vein distension. I'm going to have her turn to the side, check for jugular vein distension. There's none, good. So I'm going to have her turn to the other side as well. Again, no jugular vein distension. Okay, so I'm going to go ahead and put my pen light down. I'm going to go ahead and grab some hand sanitizer. So right now I'm going to be checking her lymph nodes. So first I'm going to do pre-auricular, post-auricular, which is behind her ears, occipital, which is the base of the skull. Then I'm going to go just below her jaw, and it's going to be retropharyngeal, submaxillary, and submental. Then I'm going to have her turn her head, and I'm going to be assessing the lymph nodes on the cervical chain below and above the sternocleidomastoid muscle. Again, on the other side, have her turn the cervical chain above and below her sternocleidomastoid muscle. Good. So also I'm going to be assessing her supraclavicular lymph nodes. So I'm going to hook my fingers above her clavicle. Good. So since we are at the clavicle, I'm going to be going below it to check her skin turgor, and it is elastic. Okay. I'm also, since I'm in the area, I'm going to be checking her carotid. The carotid is going to be palpated one side at a time. Okay, good. Also, while I'm in the area, I'm going to be placing my hands on the patient's shoulders and have her shrug. Okay, so it is symmetrical. Now I'm going to move down to the arms. I'm going to be asking the patient to tell me if she has any pain or discomfort. Good, no pain or discomfort, no pain or discomfort. So now I'm going to be checking for edema. I'm going to be palpating above the bony prominences. Okay, no edema, good. Again, palpating above the bony prominences, and good. So now I'm going to be checking for the capillary refill. I'm going to choose one finger and press on the edge of the nail bed. Okay, less than 3 seconds, good. Again, on this side, one finger, press on the edge of the nail bed, and 3 seconds. I'm also just going to be assessing the skin on her arms. So she has no lesions, she has no scars, no abnormal bruising. Her skin is warm to touch, which is good. So I'm just assessing like her as a whole. Her thoracic cavity looks symmetrical. She has respirations that are even and unlabored. She doesn't look like she has any shortness of breath. Her skin overall has like a pink tinge to it, which is normal for her, which is good. So now I'm going to go ahead and get my stethoscope. I'm going to hand sanitize. I'm going to be putting alcohol on my stethoscope to make sure it's clean. I'm going to be auscultating the carotid artery, so I'm going to make sure my bell is on. The carotid artery is auscultated between the sternocleidomastoid muscle and the trachea. And I'm going to be instructing the patient to hold their breath. Okay, so my bell is on. Go ahead and hold your breath. Okay, hold your breath. Good. So there's no bruise. So since I do have my stethoscope, I'm going to be auscultating the heart sounds of the patient. So I'm going to go ahead and turn my diaphragm on. Okay, so the first one I'm going to be on the right side, second intercostal space, and that's the aortic. S2 is louder. The left second intercostal space is mitral. S2 is louder. I'm sorry, that was pulmonic. The left second intercostal space is pulmonic, and S2 is louder. The left third intercostal space is Erb's point. S2 and S1 are equal. The left fourth intercostal space is tricuspid. S1 is louder. So for the mitral, I'm going to be going down to the mid-clavicular line, the fifth and sixth intercostal space. And S1 is louder. Here I'm going to be auscultating for a minute, and it's 80 beats per minute, okay? So since I am in the area and I do have my stethoscope, I am now going to be assessing the patient's lung sounds. I'm going to be telling the patient that every time I move my stethoscope, she should take a deep breath. Deep breath. Deep breath. Good. So now I'm going to be auscultating the right middle lobe. So it's going to be below the right arm, the mid-axillary line, the fifth or sixth intercostal. Okay, so now I'm going to be assessing the posterior thoracic sounds, lung sounds. Okay, again, telling the patient to take a deep breath every time I move my stethoscope. Good, okay. So I'm going to put my stethoscope away. Again, I'm going to hand sanitize. Now I'm going to be checking for respiratory expansion on the patient. So I'm going to be putting my hands on the lower back of the patient, about like the T10 area, and have them take a deep breath. Okay, good. So it was symmetric. So I'm going to go ahead and have the patient sit up. So now I'm actually gonna check the abdomen. So patient's gonna lay down. First, I'm going to inspect the abdomen, make sure that the umbilicus is midline, that there's no scars, no lesions, no bruises, anything like that. I'm gonna be going eye level to see if I see any pulsations, and I don't. The contour of the stomach is rounded, a little bit rounded. And now I'm going to be auscultating. So I'm gonna go ahead and hand sanitize. I'm gonna also sanitize my stethoscope. So for auscultation of the quadrants, I'm going to be using my diaphragm on my stethoscope. I'm going to start on the right lower quadrant for 15 seconds, right upper quadrant for 15 seconds, left upper quadrant for 15 seconds, left lower quadrant for 15 seconds. So I did hear about 15 to 20 gargles per minute. Since I do have my stethoscope, I'm going to change it to the bell, and I'm going to be listening for bruits. So I'm going to go midline on the left side. Okay, good, no bruits. So I'm going to be putting this away. Again, I'm going to hand sanitize, and now I'm going to be percussing the abdomen of the patient. So I heard tympany. Okay, now I'm going to be palpating and asking the patient if she feels any pain or tenderness. Any pain or tenderness? Good. Any pain or tenderness? Good. Okay, so since I am down here, I will also be examining the patient's lower extremities. I'm going to be assessing the patient's skin to see if there's any lesions, any bruises, anything like that. I'm going to be asking the patient if they have any pain or tenderness. Good, no pain or tenderness. Good. I'm going to be checking for edema, again palpating the bony prominences of the legs. Okay, no edema. Palpating bony prominences, no edema. Good. Okay, so I'm going to be checking for capillary refill. I'm going to be pressing on the edge of the nail bed. Good, less than 3 seconds. Edge of the nail bed, less than 3 seconds. Now I'm going to be assessing the muscle strength of the legs. So I'm going to have the patient push against my legs, against my hands, and then now pull against my hands. Good. Okay, now I'm going to be checking the range of motion. So I'm going to be telling the patient to bend their knee. Okay, are you feeling any pain or discomfort? Good. Okay, now the other side, bend your knee. Any pain or discomfort? No, good. Okay, so now I'm going to be checking the pulses of the lower extremities. So behind the knee is the popliteal, and they're both symmetrical. Now I'm going to be assessing for the dorsalis pedis, which is between the great toe and the second toe. And it is felt between the ankle and the toes. Okay, and I'm also going to be checking for symmetry. So they are symmetrical. Okay. So again, we're just assessing the skin, especially at the bottom of the feet. She's okay. Her muscle strength is 5 out of 5. Now I'm going to be sitting her up, and I will be testing her reflexes. So again, I'm going to hand sanitize, and then I'm going to sanitize my reflex hammer. So the first thing that I'm going to do is check the biceps. So I'm going to have the patient bend her elbows, and I'm going to put my thumb on the antecubital area, and when I hit it, I should see flexion. Good. So again, bend the elbows and then flexion. So now I'm going to be checking for triceps. So I'm going to be supporting the arm, hitting, and then I see extension. Good. So again, hitting the arm, and then I see extension. Okay. So since I do have the hammer, I'm going to be going to the lower extremities. Actually, back to the top extremities. I'm going to be checking for range of motion in the joints. So I'm going to have the patient extend her hands, and then touch her shoulders. Good. And then back to extension. Good, good, good. So I'm gonna have the patient also put her hands at her side and then raise her hands all the way up above. Good, good, good. Okay, you have good range of motion. And then now I'm gonna go down to the reflexes of the legs. So I'm first gonna ask the patient if she's had any knee surgeries or knee injuries, and she states no. So I'm going to be hitting the knee, and I'm going to be seeing extension of the lower extremity. Okay, extension. All right.